All right, so we're diving deep into Parkinson's disease today. And we've got this fantastic resource from the National Initiative for Care of the Elderly in Canada.
Yeah. It's a really comprehensive tool.
Mm.
And I think what makes it especially useful is that it's designed specifically for older adults,
Yeah, for sure.
which is particularly relevant given, the demographics we see with this disease.
Totally. So let's kind of break down the basics here. When we say Parkinson's disease, what exactly are we talking about?
Well, essentially, it's a neurological disorder,
Yeah.
and it affects the brain's ability to control movement. And so this results in a whole bunch of symptoms. Things like tremors,
Yeah.
stiffness, problems with balance and coordination. Those are some of the most common ones that we see.
Gotcha. And it's a progressive disease, right? It
Yeah,
gets worse over time.
exactly. Yeah, so Parkinson's is linked to this gradual death of brain cells, specifically the ones that produce dopamine. And dopamine is super important. It's a chemical messenger that helps our movement stay smooth and controlled. So as those cells die off, the everyday movements that we take for granted become a lot more difficult.
It's like the brain's, fine motor control system just starts to kind of glitch out. It's interesting. I see here over 100,000 Canadians are affected,
Wow.
and that number's only going to increase. That's kind of alarming.
It is. And it's not just a Canadian issue, obviously. We're talking about a global challenge here,
Yeah.
especially as the population continues to age.
Yeah, absolutely. Okay, so let's talk about some of the different ways that Parkinson's shows up. The source breaks down the symptoms into three main groups. First up, primary motor symptoms. So what are we looking at here?
So these are kind of the classic signs, the ones most people think of when they hear Parkinson's.
Uh-huh.
So you've got the tremors, especially when the muscles are relaxed.
Yeah.
And then you've got slowness of movement, which doctors call bradykinesia.
Okay, so like buttoning a shirt or tying your shoes could take, way longer than usual.
Exactly. And on top of that, you have muscle stiffness and rigidity, which makes it even harder to move around.
Mm.
And this can lead to, that kind of stooped posture that you sometimes see in people with Parkinson's.
Gotcha. Now, what about secondary motor symptoms? Are there any curveballs here?
Well, this is where things get interesting. Parkinson's can affect facial expressions, resulting in what's called a mask-like appearance. There's also less blinking. You might notice a softer voice, smaller handwriting,
Mm.
and some people even have problems with drooling and swallowing.
Wow, I had no idea the symptoms could be so diverse. Then there's that third category, non-motor symptoms. What kind of things fall under that umbrella?
So these are the symptoms that kind of go beyond movement
Mm-hmm.
and can significantly impact quality of life. So we're talking constipation, bladder control issues, dizziness when you stand up. Even sexual dysfunction and depression can be a factor.
Wow. It's a good reminder that Parkinson's is way more than just a movement disorder.
Absolutely. And it's interesting because Parkinson's can even mess with your sense of smell. Yeah. Some people lose their sense of smell years before any movement issues show up.
That's wild. I know that researchers are looking at smell tests as a way to maybe catch the disease early, right?
Right.
That could be huge for someone. Imagine starting treatment before those movement problems even show up.
Yeah, you're right. Early diagnosis could really change the whole game when it comes to managing Parkinson's. Now, as far as the progression of the disease goes, there are 5 distinct stages. But it's important to remember that, everyone's experience is different.
Right. So these stages are like a roadmap, but not everyone follows the same route.
Exactly. So stage 1 is pretty mild. Symptoms often only on one side of the body, maybe a slight tremor or some stiffness, but it doesn't really interfere with your day-to-day life.
Okay. What about stage two? When do things start to feel more serious?
So stage 2 is when symptoms start showing up on both sides of the body, and those everyday tasks become a bit more challenging. Walking and balance might be a little off, but most people can still live independently at this stage.
Okay. So stage three is the next level of progression then.
Right. This is when falls and loss of balance become a real concern. You'll likely need more assistance with activities, even though you might still manage some things on your own.
Gotcha. And then things get even more challenging in stage four.
Unfortunately, yes.
Yeah.
Stage 4 symptoms are severe, and independent living usually isn't possible.
Right. And then finally, there's stage five, the most advanced stage of Parkinson's.
Right. And at this point, a person is generally confined to a bed or a wheelchair, needing round-the-clock care for all their needs.
It's a stark reminder of just how serious this disease can be.
It is. But it's important to highlight that there's still hope and support available at every stage. Research is constantly evolving. New treatments and therapies are being developed all the time.
Yeah, that's good to hear. Okay, so we've talked about what Parkinson's is, the different ways it manifests, how it progresses. But what causes this complex disease in the first place?
Well, that's the million-dollar question. And the honest answer is we don't fully know yet.
Right. The source mentions that the exact cause is unknown. So what do we know so far?
Well, we know it's likely a combination of genetics and environmental factors.
Yeah.
But figuring out exactly what triggers the disease and how those factors interact, it's still a major scientific puzzle.
Yeah, it says here that genes only account for about 10 to 15% of cases. So it's not purely hereditary then.
Right. There are several genes that are linked to Parkinson's, but having those genes doesn't necessarily mean you'll get the disease.
Gotcha. What about those environmental factors then? What are the main suspects there?
Well, there's some evidence suggesting that head injuries where you live and exposure to pesticides might increase your risk. But again, these are just potential risk factors, not confirmed causes.
Okay. And I see that most cases develop after the age of 60.
That's true. But it's not just a disease of old age. About 5 to 10% of cases occur before the age of 50, which is what we call early onset Parkinson's.
Interesting. And there are also some differences between men and women, right?
Yeah, some studies suggest that men are slightly more likely to develop Parkinson's than women, but we need more research to really understand why that might be.
So it's this whole intricate interplay of genetics, environment, and age, a real medical mystery.
It is. And the fact that the cause is still unknown, well, it makes prevention and treatment that much more challenging.
Right. Well, speaking of treatment, let's move on to how Parkinson's is diagnosed and managed. What's the process like for someone who, suspects they might have this disease?
Well, diagnosis is mostly based on those motor symptoms we talked about earlier. Doctors look for things like the characteristic tremors, slow movements, and rigidity.
Right. But I imagine it's not just a matter of looking, is it?
No, not really.
Hmm.
There's no one single test that can definitively diagnose Parkinson's. Sometimes doctors use brain imaging like an MRI or a CT scan to rule out other conditions and kind of back up that clinical diagnosis.
So it's a process of careful observation and evaluation. And once someone is diagnosed, what are the options for managing the disease?
Well, medications are the primary way to manage Parkinson's. The main goal is to improve symptoms and enhance quality of life.
Gotcha. The source specifically mentions a drug called levodopa.
Yeah, levodopa has been the go-to treatment for over 50 years. It works by converting into dopamine in the brain, which helps to replace what's been lost.
That makes perfect sense. But are there any downsides to using levodopa?
Unfortunately, there are. Levodopa's effectiveness can decrease as the disease progresses, and a lot of patients experience side effects like involuntary movements, what we call dyskinesias.
Okay, could you explain a bit more about what dyskinesias are?
Sure. Basically, dyskinesias are involuntary movements like twitches or jerks. That can happen as a side effect of levodopa. It's one of the challenges of managing Parkinson's over the long term.
I see. So what other options are there for people who can't tolerate levodopa or need additional help managing their symptoms?
Well, there are a few other types of medications, often used alongside levodopa to kind of tackle those various symptoms. So one group is dopamine agonists, which essentially mimic dopamine's effects in the brain. And then there are enzyme inhibitors, which help make the levodopa last longer in the body.
So it's like finding the right recipe of medications to manage symptoms while minimizing side effects.
Exactly. And each person responds differently to medication, so it's a very individualized approach.
Right. Are there any treatments beyond medications, though? What about surgical options?
Yeah, for people with advanced Parkinson's who aren't responding well to medication, surgery might be an option. The source mentions deep brain stimulation, or DBS for short.
Ah, yeah, DBS. That involves implanting electrodes in the brain, right?
That's right. These electrodes send electrical impulses to targeted areas of the brain that control movement. TBS can be really helpful in reducing tremor stiffness, and even those medication-induced involuntary movements we talked about.
So it's not a cure, but it can make a big difference in someone's day-to-day life.
Precisely. It's important to understand that DBS doesn't stop the disease from progressing, but it can help manage the symptoms more effectively.
Right. The source also talks about infusion therapies. What's the story there?
Well, infusion therapies are less invasive than DBS. They involve delivering medication directly to the intestine, which kind of replicates the natural way that dopamine receptors are stimulated in the brain.
Okay, so there are a range of treatment options from medications and surgery to these innovative infusion therapies. It sounds like doctors have a lot of tools in their arsenal to fight this disease.
They do. And the choice of treatment really depends on the individual, how far along their Parkinson's is, and how they respond to different therapies.
Now, this might be a bit of a sensitive topic, but let's talk about life expectancy. It's something a lot of people with Parkinson's and their families worry about.
Yeah, I understand. It's a natural concern.
The source mentions that back in 1967, the average life expectancy after a Parkinson's diagnosis was less than 10 years.
Right. That was then. Luckily, things have drastically changed, thanks to all the advancements in treatment and disease management. The average life expectancy has increased by about 55% to over 14 and a half years now. And many people live much longer than that.
That's definitely good news. So while Parkinson's is a serious condition, it doesn't necessarily mean a drastically shortened lifespan.
Absolutely not. With proper care and support, people with Parkinson's can live long and fulfilling lives.
Well, this has been a really informative look at the complexities of Parkinson's disease. We've gone from the basics to treatment options and even touched on life expectancy. What's the main thing that stands out to you from all this information?
I think for me, it's the sheer variety of symptoms, both those related to movement and those that aren't. It really underscores that Parkinson's is a multifaceted disease. It affects the whole person, not just their physical abilities.
Yeah, that's a great point. And I'm really impressed by how much progress has been made in treatment and extending life expectancy. But there's still that big question mark around the cause of Parkinson's, right? That's got to be frustrating for researchers and patients alike.
It is, and that's why research is so important. Unraveling the mysteries of this disease is key to developing even more effective treatments, and hopefully one day, finding a cure.
Well, we're going to shift gears a bit in the big impact. Now, as we wrap up our deep dive, I'm really struck by the progress that's been made. We've gone from a time when a Parkinson's diagnosis was incredibly bleak to a time where there's genuine hope.
Yeah, it's true. The advancements in research, the innovative treatments,
Yeah.
and the commitment of researchers and healthcare professionals, it gives us so much to be optimistic about.
It's a powerful message of hope. And to all our listeners out there who are dealing with Parkinson's, either personally or through a loved one, remember you are not alone. There are amazing resources available, a supportive community, and incredible advancements on the horizon.
Keep learning, stay connected, and never give up hope.
This deep dive has been just a glimpse into the world of Parkinson's. We hope it's given you a foundation of knowledge and sparked your curiosity to learn even more. Thanks for joining us on this journey of discovery.